Good day, I'm Dr. Hiralal and I work at the Port of Spain General Hospital in the anesthetic department. This video will provide the basic information about how a spinal anesthesia is performed for your cesarean section. You will be seen by your anesthesiologist before surgery, who will take a history, examination, and discuss the type of anesthesia. For your cesarean section, there are two main types of anesthesia. The first and more popular type is a regional anesthesia, where you are awake for the surgery with numbness from your waist downwards. The second type, which is less commonly used for cesarean section, is a general anesthetic, where you are asleep, intubated, and placed on the ventilator for the surgery. Regional anesthesia has been accepted worldwide for the majority of cesarean section due to its safer profile. There are three main types of regional anesthesia, which includes 1. A spinal anesthesia, and this is the most commonly used method, 2. An epidural anesthesia, or 3. A combination of both a spinal and an epidural. With this type of anesthesia, the lower half of your body will be numb, so you do not feel any pain or discomfort. This technique is safer for you and your baby. So what is a spinal anesthesia? I will start by reminding you that it is the most common type of anesthesia used for cesarean sections worldwide because of its safer profile when compared to a general anesthetic. For a spinal anesthesia, the local anesthetic is injected using a very small needle in the lower back. The needle is inserted well below the level of the spinal cord. The anesthetic medication will block the nerves from the lower part of your chest to your toes. You won't feel any pain in this area and you won't be able to move your legs. This is necessary to perform the cesarean section. This block will last approximately 2 to 3 hours. If your cesarean section is anticipated to be longer than 90 minutes, an epidural catheter may be inserted at the same time. This will allow your anesthesiologist to give additional anesthetic medication to prolong the duration of the block. The anesthesiologist may occasionally opt to do an epidural only in special cases, and it is similar to a spinal except for its longer onset time of approximately 20 to 30 minutes. So how is a spinal or epidural performed? The person performing your spinal will be an anesthesiologist who is a doctor specialized in administering anesthesia. He or she may be accompanied by another anesthesiologist and an assistant. Your spinal will be performed in the maternity operating theater. Before performing the spinal, it is essential to obtain an intravenous access, which is a thin plastic tubing that remains inside the vein, allowing us to give medication and fluids. Your blood pressure, ECG, and oxygen saturation will be monitored throughout the surgery. The key steps involved are your anesthesiologist will take a history, examination, and discuss the type of anesthesia before going to theater. In theater, you will meet additional personnel, such as other anesthesiologists, anesthetic assistant, nurses, midwife, obstetrician, and pediatrician. Everyone has their role to ensure a safe delivery. You will be assisted into the correct position for the spinal. The anesthetic team will explain what is happening behind your back. The anesthesiologist will perform the spinal. You will then lay down and the effectiveness of the block will be assessed. Proper positioning is extremely important for a quick and safe spinal. You will be assisted into the correct position. The spinal is typically performed in the sitting position. The image on the left shows a patient in the correct position for a spinal, with your back arched, forming a C along the spine, with your shoulders slouched and your chin resting on your chest. Meticulous care will be taken to prevent infection. Your back will be cleaned with a special antiseptic, and this is to reduce the chance of infection. A large sterile drape will be placed over the lower back. After cleaning and draping, a suitable point for the spinal is identified. First, your skin will be numb before performing the spinal. This is done by injecting a small amount of local anesthetic at the point for the spinal. This may sting for a moment, and then the skin and tissues will become numb. When the skin is numb, a very fine spinal needle is inserted between the bones of the lower back, noting that this is well below the level of the spinal cord. Once the spinal needle is in the correct space, the local anesthetic will be given via the spinal needle. You may occasionally feel tingling down the leg, hips, or buttocks. If this happens, please tell your anesthesiologist. The spinal needle will be completely removed and a plaster placed at the puncture site. You will then be assisted to lay on your back, and your anesthesiologist will test the spinal block to make sure it is working well. The spinal may be assessed by one or more of the following: the ability to raise your legs, sensation to pain after a pinprick, or the sensation to cold. Only after your anesthesiologist is satisfied that anesthetic is working well will he or she allow surgery to start. Your anesthesiologist will be present throughout the surgery. He or she will provide necessary care for you while surgery is ongoing. Some people worry that they may see the surgical site. However, during the surgery, we place a large drape so you do not see anything. I am sure you are curious to know what you will feel during and after the spinal, especially if this is your first time. To start with, most patients report that it is often not painful. Most patients feel no abnormal sensation. However, as the medication is given, few report feelings of pins and needles or sharp pain in the leg. If you do, remain still and inform your anesthesiologist. Your skin will feel warm, then numb, and gradually your legs will become weak. Once the spinal has taken full effect, you will not feel any pain from your waist go down, and you will not be able to move your legs. This is normal and essential to perform the surgery. Your legs usually return to normal in 6 to 8 hours. During the cesarean section, you may feel pulling or pressure, but you should not feel any pain. Many patients wonder why we offer a spinal anesthesia. Well, there are many reasons why. Whenever a patient has a general anesthetic, she needs large doses of medication, needs to be intubated, placed on the ventilator, and is at the risk of developing nausea and vomiting after surgery. So here are some of the main advantages of a spinal anesthesia. When compared to the general anesthetic, it is a safer type of anesthesia for both you and your baby. You will be awake to experience the birth of your baby. After delivery, your baby will be seen by the pediatrician, and once he or she is doing well, you will be able to hold your baby for a short time. As a result of the spinal, your baby will be more alert at the delivery, which will allow better bonding. You will have minimal risk of aspiration or choking, as you will be awake for the surgery. Pain relief is superior with the spinal. You will also be less sleepy after surgery, less nausea and vomiting, and once surgery goes well, you will be allowed to eat and drink once you are on the ward. A spinal anesthetic is safe and it is rare to have complications, but as with all medical procedures, there are some risks. The major risk associated with a spinal is very rare and is almost the same chance as a major complication following a general anesthetic. I will now go through the risks associated with a spinal or epidural. So common side effects include itching and a drop in blood pressure, both of which are easily treated. In some cases, due to abnormalities in the lower back, it is difficult or even impossible to perform the spinal. A general anesthetic may be considered in this case. In some patients, despite good technique, the anesthesia does not work well. In that case, the anesthesiologist and surgeon will decide the next safest alternative. Your surgery will not be performed with you in pain or discomfort. 1 in 100 patients develop a headache due to a spinal, and this is called a post-dural puncture headache. It usually results with bed rest, adequate hydration, and painkillers. Very rarely you will need another injection into the back for the headache to stop. The risk of nerve injury is very rare, 1 in 200,000 cases. It can be temporary or permanent, and symptoms include areas of tingling, numbness, or even weakness in the legs. Most cases resolve over time. The risk of infection is very rare, and precautions are taken to reduce this risk. Bleeding is very rare, and this technique will not be performed on patients who are at increased risk of bleeding. On the day of surgery, you and your anesthesiologist will decide which is the best type of anesthesia for you. You will be given all the information, and the final decision is yours. After surgery, you will be tidied and transferred to the recovery room. Here you will be monitored for a short time, and once you are stable, you will be discharged to the ward. Thank you for watching this video, and I do hope it was well worth your time. I would like to wish you a safe delivery and a quick recovery.